So the Wellcome Trust project I'm working on is around Zika, health emergencies and abortion. And what we want to do in this project is understand how the Zika outbreak, framed as a health emergency, affected women trying to seek abortions and also providers of abortion and regulation of abortion. So it's quite a multifaceted project. What's interesting to us is that actually, the Zika outbreak raises a lot of broader questions around women in health emergencies and the sort of injustices that women can face during emergencies. And so I think there's sort of 3 or 4 key issues to think about when we think about women in health emergencies and the Zika outbreak in particular. The first one is that it showed us that in the Zika outbreak and in health emergencies more broadly, there is no real consideration or provision of sexual reproductive health facilities. People hadn't thought about how to provide these sorts of services in a health emergency before. So this is a glaring gap in the health emergencies agenda. The second thing we think it tells us is about the structural violence which pervades everyday life in most of Latin America for these women and how they fell outside of response efforts because of these structural injustices. If you're not part of the system, if you're not part of a healthcare system, if you can't access a healthcare provider, or antenatal care because of various intersectoral factors, then it doesn't matter what response is being launched. A third thing that it tells us is the need for a more rights-based approach. How can we make sure that these women's voices are heard? How can we make sure that their reproductive rights and more broadly their human rights are considered in an outbreak or an emergency situation? And more fundamentally, I think what this outbreak has shown us is that actually women weren't really considered. The women who are most vulnerable in the outbreak weren't really considered in the response effort. Responses were mounted globally and nationally, which were trying to stop the outbreak, but no one really thought about the everyday lives of these women and what policies might actually improve their living conditions and or reduce their risk to contracting Zika through improved vector control, or what policies might be more pertinent and have much more long-lasting effects on the health of these women.